the afternoon. I am excited, though, that even though some things have changed regarding the Brown Act as far as remote meetings, looks like we're going to be able to preserve the remote meeting element of the continuum of care meetings. It will change for the Board of Governance just due to the fact that the structure of the Board of Governance is a little bit different than the continuum of care. And so we are excited we'll be able to preserve remote meetings. We know that all of you are so very, very busy serving your part of the county where you work and helping so many people. And a lot of times we know you often have to multitask or run from one meeting to the next. So I'm thrilled that we're going to be able to keep the remote element of the continuum of care meeting, although we are discussing maybe at some point getting together once a quarter if we can, face to face, where we can just have that personal interaction, and we'll have more details to follow on that. But I just want to say welcome to all of you. We're going to go ahead and dive into the meeting, and I'm going to pass it over to David, our wonderful David Escobar, who's going to do roll call. So David, take it away.
Thank you, Karen. Okay, so I'm going to go ahead and pull up the Excel spreadsheet here. I'm going to go through roll call. If the primary member is here or the secondary, please feel free to unmute yourself and let me know. So I have alternatives to domestic violence, Gary and Brown. No. Maria Talavera. Brilliant Corners, Narmin Noura. Tyler Fong. Catholic Charities.
Here, this is Maria.
Maria, okay, thank you, Maria. Citizen Advocates for Senior and Homeless Solutions is Jenna present. CityNet Jessica Avalar Bruce.
Here.
Hey, Jessica, welcome.
City of Banning, Roman or Jennifer. City of Eastville, Ava.
This is Ava. I'm here.
Hey, Ava.
City of Hemet, Linda or Veronica.
Linda is here.
Thank you, Linda. City of Lake Elsinore, Elizabeth or Alex. City of Menifee, Edna. City of Moreno Valley, Ashley or Viviana.
Present.
Thank
Ashley,
you.
Aparicio, thank you.
City of Marietta, we have Brian or Lindsay.
Lindsay's here.
Thank you, Lindsay. City of Harupa Valley, we have Amy or Michael. City of Paris, we have Michelle or Sarah. Okay. And then City of Riverside, we have Michelle or Larissa. No Michelle, no Larissa. Okay. City of San Jacinto, we have Robin or Cynthia.
Robin's here.
Thank you, Robin. Coachella Valley Association of Government, I have Ivan or Stephanie.
Stephanie here.
Thank you, Stephanie. Coachella Valley Rescue Mission, Kimberly or Jesus.
Kimberly's here.
Thank you, Kimberly. Community Health Association Inland Southern Region, Brianna or Sandy.
Brianna's here.
Thank you. Colonel Norco Region, Karen Roper or Jim. Okay. Department of Public Social Services, Renee or Linda. Okay. Department of Healthcare, Desert AIDS Project, is Monica present?
Yeah, I'm here.
Thank you, Monica. Desert Healthcare District, Donna or Chris.
Donna's here.
Faith in Action, Carol or Mary. Family Promise of Riverside, is there Claire or Vicky?
Yes, Becky's here. Sorry.
Thank you. Foothill AIDS Project, Leslie or Jose? High Expectations Development Corporation, Nikisha or Marcus?
Nikisha is present. Hello, everyone.
Thank you, Nikisha.
Hello.
Inland Empire Harm Reduction, is Shireen or Audrey available? Inland Empire Health Plan, is Ben or Shelly here?
Good afternoon, Ben's here.
Thank you, Ben. Jewish Family Services, is Becky or Erica available?
Hi, this is Becky.
Thank you. Labor of Love, is Kim here? Lake Elsinore Unified School District, is Denine or Mary here?
Sorry, David. This is Kim. I couldn't find my mic to turn it on. Labor of Love is here. Thank you.
Thank you, Kim. Okay, and then Llama's Housing Project, is Sonia or Carolina present? Lighthouse Social Services, is Karen or Brannon?
Brandon's here.
Thank you.
No problem.
Lutheran Social Services, Denise or Ricardo here? Martha's Village and Kitchen, is Linda or Rose available?
Linda here.
Thank you, Linda. Mary Erickson Community Housing, is Ayako here? Mercy House, is Sasha or David Jacobs here?
I'm here. Charles Chapman, Mercy House.
Mercy
Hey, family,
House.
how y'all doing today?
Okay, Charles. Charles, are you one of the representatives for Mercy House?
Yes, sir. I am the representative for Mercy House. And then Sasha is the second representative for Mercy House. That should be updated.
Okay, apologies if it hasn't been. I'll
Nope,
have to
No worry.
go up
All
and
right.
check. Thank you. Molina Healthcare of California, Nita or Dave here?
No, Nita's joining shortly, but my name is Shannon Padilla.
Okay, thank you,
From
Shannon.
Molina.
Oh, from Molina. Okay.
Yeah.
Operation Safe House, Sandra or Norma here? Path of Life Ministries, Chris or Leonard?
Hi, this is Chris.
Chris.
Hi, I'm sorry. This is Julie from Safe House. Sandra and Norma were unable to attend.
I'm sorry, can you repeat from Operation Safe House? Okay.
Yes.
Thank you. I have QueerWorks, Jacob or Jason? None. RCCD, Chris or Jeremy? Riverside County Sheriff Station Hot Team, Julie or Julianne?
We're both here.
Hi.
Thank you. Riverside University Health Systems, Marcus or Angelica?
Angelica here. Hi, everyone.
Thank you.
Hello.
Riverside Unified School District, Chris or Ozzy? Romulan School District, Midea?
Hi, everyone. This is Mireya from Romuland.
Thank you, Midea. Shelter from the Store, Angelina or Maricela?
Hi, good afternoon. Angelina here.
Thank you, Angelina.
Welcome.
Silence Out Loud. Oh my God, I should be very confident about this. Kanika or Kanayo? No. Okay. Apologies if I misread your name. Step Up on Second, Greg or Alberto? Transgender Health and Wellness Center, JM or Nell?
Nell's here.
Thank you, Nell.
Marisol is also here.
Marisol, what organization are you with?
Transgender Health and Wellness Center.
Okay. And then have you been assigned as a alternate or as the main representative?
Main representative.
Okay. Thank you, Marisol. Turn Behavioral Health Services, Danielle or Rebecca? Oh, sorry, wrong list. Turn Behavioral Health Services, Michael or Ranfis? Inland SoCal United Way, Danielle or Rebecca?
Hi, friends. Danielle's here.
Thank you. US Vets, Nicole or Dr. Bowers?
Nicole is here, but I sent the information for our alternate. It should be Keith Wainwright.
Okay, thank you.
Thank you.
And VA Loma Linda Healthcare, Oscar Ramirez? Valley Restart, Perry or Javier?
Perry is here.
Okay,
Did you get it? You got it?
yes,
Okay.
sir, I got it. Thank you. And with that being said, Madam Chair, we have reached a quorum.
We have, great. One thing we may want to, because normally the meetings, we have a lot more attendance, and I have a feeling it's the change in the meeting. I'm sure it's also a busy time, but maybe we can huddle afterwards and figure out a follow-up to everyone. I know you sent the notices out, but we'll maybe do something a little extra to follow up with everyone. We want to make sure we keep the participation levels high, because everybody that's part of the continuum of care is so important, and your contributions and being a part of this consortium is super important to the success of our region. So what we're going to do now is we're going to move to the next portion of the agenda. I think, go back, and we're going to introduce new members. Is that right, David? Yes. Okay. So I would like to welcome two new members to the Continuum of Care. We have Jason Austin from the City of Palm Desert and Shannon Shea from Elder Love USA. If you are here, you're welcome to say something. I know Jason is here. Is Shannon here also?
Yes, I'm here.
Perfect. So Jason, we'll start with you if you want to say a few words, and then Shannon, after that, you can say a few words. We'd just love to hear from you and welcome you.
Sure. Thanks, everyone. I'm very excited to be here. I'm new at the City of Palm Desert as the new social services coordinator. I actually knew Karen. We both worked for the County of Orange back in the day, and I'm very happy to be here.
Thank you. Shannon?
Hi, everybody. I'm Shannon Shea with Elder Love USA, and Linda Barak invited me and told me about this group, and I'm so excited to be here and to join. Even though I usually deal a lot with seniors, I really, they have grandkids, and we still want to deal with children and kind of the continuum.
Absolutely. And there's been a big focus on ending senior homelessness in our continuum of care. And we know we have an age tsunami. And if older adults don't have proper plans for retirement, they're either at risk or end up being homeless. So welcome. There's plenty of room at the table, and we look forward to working with you and learning from you.
Thank you so much.
You're welcome. And David, I don't think we have any new voting members at this time. Is that right?
That is correct. However, by next meeting, we will have a few announcements for those members. We do expect to have some in the next meeting.
Great. And if those of you, if you're not familiar with our governance charter requirements to become a voting member, first you need to be appointed by somebody that's an authority in your organization to appoint you to the continuum of care, and then you need to attend 3 consecutive meetings to become a voting member. So I'm excited that we're going to have some new members, and it is super important for us to make sure that we are as inclusive as possible. So like what Linda did when she invited Elder Love USA, we hope that you will be thinking about other stakeholders in the community that should be with us, because we are definitely stronger together. So with that, David will go ahead and move on to the next agenda item, which is agenda item number 2. At this time, we're going to consider agenda item number 2, which is to approve the February 22nd, 2023 Continuum of Care meeting minutes. And so what I'd like to do is entertain a motion for approval of the minutes. Do I have a motion?
I'll
Motion.
put forth the motion.
Did you get who that was, David? Who put forth the motion?
It was 2. One was from Kim, Labor of Love, but I'll either put forth the motion or I'll second it.
Okay.
So I have a motion from Kim and a second from,
Nicole, I'll second it from US Vets.
thank you, Nicole.
Perfect. Do I have any abstentions or objections? Okay, hearing none, the item passes. All right. We can move on to the next agenda item, which is agenda item number 3, public comments. At this time, members of the Continuum of Care can entertain public comments from any member of the public for any item that is not on the agenda. You have up to 3 minutes to make a public comment. Are there any members of the public that would like to comment? And then David, you can let us know if we received any written comments. And you can raise your hand if you have a public comment. Okay, hearing none, we'll move on to the next agenda item, which is agenda item number 4. This is one of my most favorite parts of the agenda every month. Those of you that know me know that one of the things I wanted to do as the chair of the Continuum of Care is to make sure that we spent time in each of our meetings to have a leadership spotlight to focus on the great work that's happening in our region and to hear about not just a great leadership, but innovative programs, success stories. And so this month, we're excited to have Robin from the city of San Jacinto, and I know that she's working with a collaborative of people in her region. So Robin, we'd love to turn the floor over to you. I know you have an exciting presentation for us.
Good morning. Thank you, Karen. David, you have the PowerPoint, I assume.
Yes, ma'am. I will go
Okay.
ahead and pull up the PDF version.
Thank you. Yeah, that one's better. It's funny how you lose things in translation.
There we go.
Yay. Awesome. Well, good afternoon, Madam Chair, staff, and members of the Continuum of Care. My name is Robin Gilliland of Robin Gilliland Consulting. For those who don't know me, I began my homeless services career while working for the city of Temecula. I spent 25 years there, with the last 6 in homeless services development. In collaboration with my neighboring cities, we launched the Regional Homeless Alliance, as well as the Responsible Compassion Campaign. Upon my retirement from Temecula, the fantastic city of San Jacinto contacted me, and here we are. I hope you enjoy and appreciate the excellent work in this area of the county. Next slide, please. Do I have to do it, or can you do it, David? Okay.
I got you.
Thank you. As we began to search for names for our outreach program, the city manager, Rob Johnson, came up with HARP, which stands for Homeless and At-Risk Population. Our focus is assisting street-level homelessness and preventing those at risk. As you see from this slide, we just are one component of a very comprehensive community outreach program, which coins the term Be Healthy, Be Well, Be San Jacinto. Next slide, please. And that's me. That's my little logo that I came up with after I retired. Next, please. So as we launched HARP, we it's October 2020 is when the city really started launching HARP here in San Jacinto, and we began talks. I actually started working in January of 2021, doing assessment, making some recommendations, working with our staff here in the city to apply for the ESG grant. And of course, I love attending the CoC and Board of Governance meetings. After our, first months of assessments, as with most organizations, we had to find some money. So we obviously went for the grants, and thankfully with the guidance of the HWS staff, we successfully acquired the ESG grant, which allowed the city to hire the fantastic CityNet organization to conduct street outreach. Quickly thereafter, additional funding was allocated to us for emergency shelter. With these two components, they were game changers for the city. Next, we began to create collaborative partners. Next slide, please. This just goes into a little bit, just talks about the grants that we received, and then the next one talks about the breakdown of how we have utilized it. The next slide. Thank you. So this really, as I mentioned before, was really the what catapulted us to be able to start this amazing program out here. And as you see at the bottom, the HIP grant, or as Amy calls it, the HIP grant, is just getting kicked off, and we're very thankful for that as well. Next, please. This next slide talks just a little bit more in detail about sort of what I did and as a team, what we did. Obviously we did the discovery phase, where I really looked to see if there were any local resources. And sadly, there really wasn't a lot in the area here. Then I began to network, establishing partnerships as quickly as I could. We conducted an independent census here just so I knew what numbers I was looking at when I first started. Obviously, we got the grant, which allowed us to hire CityNet and get the emergency shelter rolling. We do host community events, resource events, cleanups, and obviously we participate in the point in time. The boots on the ground is the street outreach and case management. Zero tolerance event. We do work with law enforcement here when they do host the quality of life zero tolerance events. CityNet and myself are here to provide resources to individuals that may be caught up and got arrested that day. We are there to offer them potential resources when they get released from jail. We developed a crime reducing business kit. And we are actively working on that right now to help our local businesses, obviously community education, and now we're working on housing with hopefully some local cities. Thank you, David. You're good. So this is our networking and community partnership. Obviously, we put the city in the middle because we sort of are the landlord, so to speak, of this program. We really work closely with the school district here, as well as Mount San Jacinto College. We partnered with them and did an amazing resource event not too long ago. And you can just read for yourself. We've got public safety, the street outreach with CityNet and case management. Faith-based community is critical, as well as our business community. Next, please. Our faith-based community is amazing. Obviously, we rely heavily on them. They know our community. They are in the community. One of the really amazing things that we've been allowed to do out here is be a part of the Care Portal system. Care Portal is generally only open to local churches. And when the regional director, I met her at an event with Project Touch, and we talked about, we have individuals that we try to assist as well that have children. So they allowed us as San Jacinto, the city, as well as the school district, to be sort of their partners and let's just see if it works. And so far it's been working amazingly. We also have San Jacinto Assembly of God Church here, which gives us space every few months to hold an amazing resource fair. And then 412 Church, as you can see here, they provide cards, whether it's food cards, laundry cards, gas cards for single moms, whatever we need. They've been very generous in doing that as well. Next, please. So the collaborative neighbors approach is obviously I'm a big proponent of collaboration. I think it's critical. I think that what what works is working together. And the component with these three cities, which is Hemet, San Jacinto, and Paris, what we do is we share a lot of information. CityNet is in all three of these cities, and there's a lot of collaboration, there's a lot of resources, and there's a lot of support amongst these cities when it comes to case management. So that has really created a great synergy for collaboration, and they just are amazing, the collaboration that they do at the case management level. Also at the city level, we're in talks to potentially, maybe look at some housing options, and we just are trying to bring as many resources to this region as we can. Next, please. This is just a sample of some of the community events that we've done. I and all of us here at the city have called our church collaborative Hope Warriors. We feel like we are out there fighting and giving people hope. And we've held 3 events, with one coming up here very shortly, which provides a lot of rental assistance. And thank you to all the county departments that come out every time. Again, I mentioned the Crime Reducing Business Program. I am really stepping that up, working collaboratively with our code enforcement department. Not only do we help the local businesses understand, how to lovingly, but sometimes firmly handle individuals that are entering their business, but also keeping their 602 no trespass forms up to date so that we can give law enforcement the tools they need as well. Next, please. And with that, I would love to introduce Gabby from CityNet, and she will go over the amazing work they do here.
Hello, my name is Gabrielle, but you can call me Gabby. I'm one of the case managers for Street Outreach in San Jacinto. And can we please turn to the next slide? So I've been doing this for almost 2 years in the city of San Jacinto, and who we serve are individuals in the city of San Jacinto experiencing street level homeless. For example, those who are living in cars, tents, outdoors, abandoned buildings, uninhabited areas, and this also counts for our families as well. And how we serve is we've been utilizing the emergency shelter and appropriate prevention and diversion methods, whether it's a bus pass or for family reunification or a Greyhound ticket, we do that as well. And more recently and more lately, we've been seeing a lot of a different kind of face of homelessness. More recently, we've been seeing a lot of families, and because of the housing market, we've been seeing a lot of families who are evicted more recently, and of course, those with medical conditions. It's not just a black and white kind of picture of what homelessness is, and these are what we're seeing on the streets. Next slide, please. So for San Jacinto, this is for self-identifying statistics. We've been seeing 27% with chronic health conditions, 27% with mental health issues, substance abuse disorder 18%, and physical disability 4%. Of course, these are self-identifying statistics in the first place. So of course, the barriers are much likely going to be higher. And as for gender, we have 59% female, 59% for males. And here are just some facts and statistics for you all. Next slide, please. So during outreach, what is offered to clients, of course, is shelter resources. We try our best to utilize different shelters because San Jacinto is a little bit farther than other cities to local shelters. Sometimes clients are not willing to go that far out, but we've been grateful to be using a couple of shelters near us, like Valley Restart. So as far as we do try to connect our clients to substance use and mental health services, connection to basic benefits such as food stamps, general relief, and of course, obtaining documents, which are very important to getting housed in the first place, such as ID. Please excuse the alarm. Gonna let it go. And of course, social security cards, award letters, benefit letters, and bank accounts. A big one that we have been able to utilize is, of course, transportation. My partner and I are able to utilize our work van, and we can take clients to their appointments, whether it's the DMV, doctor's appointments, going to shelter. And so that's one of them. And then we can help with employment assistance, taking them to workforce development and HEMIT. and also housing navigation, because sometimes we do have the ability to look at what's available and try to connect our clients to those units, and relocation and family reunification as well. Next slide, please. So for barriers to quick results, of course, there are limited resources, especially here in San Jacinto, because we are far away from a lot of resources. And a lot of the times we get the question, well, why can't our clients just get jobs? Well, of course, getting I-9 documents is a huge barrier that we've been seeing. It is very difficult for our clients to simply get a social security card because they don't have an ID, or maybe the ID process takes about 3 to 6 weeks, or it gets sent to general delivery and they don't check their mail and it gets lost. So there's a lot of different barriers for our clients getting jobs. And of course, we have a lot of clients who are also disabled, and a lot of the time our clients get declined for Social Security, and because it's such an extensive process, we never have a clear timeline of when a client is going to be able to get Social Security in the first place. And of course, the influx of individuals from other communities who tell us they're being pushed out. Next slide, please. So this is some of our statistics. The program has been running since July of 2021 up till now. And we have, of course, the two programs, the street outreach and the emergency motel program. And my partner and I are the two that run both of those. So right now we have 178 current clients, 125 street exits, and 1,398 total contacts. Next slide. Thank you so much.
Thanks, Gabby. So back to me. Moving forward, we just are working diligently to continue to develop relationships with the community and stakeholders here. We are starting to work a little bit more collaboratively with Saboba Tribe. So there's a lot of opportunity there. Community education continuation is always huge. I think that oftentimes the community gets frustrated because they don't realize the barriers that CityNet has to overcome just to get that individual to the next step. Partnering with CoC to continue to roll out the crime reducing business kit. We certainly want our businesses happy. We understand their frustration, so we try to work really hand in hand with them. Obviously, I love working so closely with the county, so I continue to work on building those relationships. Housing. We know that we all need more housing, and I have 10 rooms. That's it. That's all we got out here. So, and that's only emergency shelter. So obviously that's high up on the priority list for moving forward. Resource events, again, I think are critical to keeping not only our homeless individuals moving in the right direction, but also to prevent future families from hitting our streets. And then, of course, I'm always looking for money. So always looking for the next grant opportunity. And then we just like to coin the term, keep our foot on the gas. Next slide, please. Thank you. This is, we just pushed this out. We call this our alternate giving campaign. We just want to educate the community on different options besides, handing out a sandwich or handing out a blanket. There are many other alternatives and that could really, really help and impact these individuals in a more positive manner. So these are some of the social media campaigns that we kind of push out. One thing that I did do here that I hadn't done previously was I created a registry for the HEART program with Target and Walmart. So if an individual, has the heart to help a young family or even a person that is getting off the streets, they can go to target.com and look at what we've registered for, and they can purchase brand new items and bring it to San Jacinto City Hall. Sorry. CityNet's office is at a school site, so time to go back to class. So I would love to invite all of you who are interested, who have resources that would love to come be a part of our next resource event. As you see, it is not March 23rd, it is May 23rd, 2023 from 10 to 3:30. Many of you have come previously, and we are so thankful for that. We have extended the time a little bit. This time, usually we ended at 2. This time we're staying till 3:30 in hopes of capturing more families who are really on that brink. And we're definitely seeing that uptick here. So we love our Tuesday events. Carol's Kitchen is cooking and there's food and groceries and, it's a really good time. So please get in contact with me directly if you are interested in coming to that event. And then next slide, I think that is it. So I am open to questions if anybody has anything for Gabby or myself, or thank you so much for the opportunity.
We did have a question in the chat from
Oh,
Carol. It
sorry.
says, can I get Gabby's contact information?
Absolutely.
Of course.
We will. You want to type it in, Gabby?
I will. I'll type it in right now.
Thank you.
Thank
And
you
as Gabby
so-
does that, we do have a hand raised from Greg Snow. Greg, take it away.
Good afternoon, Robin. It's good to see you again. It's been a while. I do think it's probably due to the situation we've all been in with COVID, but I do enjoy the events that you guys, the city of San Jacinto has hosted. It's some great news with CityNet. I was unaware, did not know that this was happening, so I just kind of want to put it out there that I'd love to be able to be out there on May 23rd for sure. Kind of get everybody's face and stuff that's out there. But definitely her contact information. I just see it got typed in, and that's what I was going to ask. But we've been living in silos because I was totally unaware. I've been servicing the community out here since 2013, and this is new to me. But thank you.
Awesome. Yes, we love having you, Greg. Thank you.
Well, I have a couple of comments and then a question too. First of all, I do want to also give a shout out to CityNet. They are awesome. We do have them in the city of Corona and also the city of Norco. They're an amazing partner, and they've been systematically developing partnerships with different cities, and they try to tailor what is needed to the needs of the local government, which is really nice. It's not necessarily a one size fits all. The other thing that I wanted to comment on is, Robin, just how much I admire and adore you. From the time that I first stepped foot in the Riverside County Continuum of Care, I always just admired your leadership and what you were doing with RHA, and then to see just the quantum leap that you've made, starting with the development of this collaborative and the partnerships. It's truly remarkable. And I know that it's a testimony to your leadership and your good work. So I want to say congratulations to you and the whole team that stands with you. And I thought maybe because one of our goals in our homeless action plan, and it's truly a goal of mine as the chair, is to make sure we do everything possible to empower other cities to help them to build capacity. And you talked about the different funding sources, and I hope I'm not putting you on the spot, but hiring a consultant is clearly another strategy for cities. So like, for example, Corona Norco, they came under Corona's umbrella, and I managed their program, so they didn't have to hire a full-time staff. That's one strategy. The strategy that's being used in San Jacinto is they've hired you as a consultant, and I was hoping you could kind of talk about how you're funded as a consultant, and maybe if there's other cities on the line that are listening, might be helpful.
Certainly. Yeah, thank you for that, Karen. Actually, I was hired once the tax revenue, once the tax assessment, I can't talk right now. When they got the sales tax revenue approved in the city, that allowed them to be able to afford me. And I think the timing was just so perfect. And I also love, as I mentioned, working with Paris and Hemet right now has been primarily, I obviously know Hemet, but it's been primarily with CityNet and their law enforcement team. But I do have a meeting coming up with their subcommittee. So I just I just wanted to be able to continue to help people, even though I left where I was before. But I definitely enjoy being out here, and I love building programs and helping people as quickly as I can. And honestly, just trying to think outside the box, because clearly a lot of times You can throw a lot of money at things and nothing seems to move. But I think with a team like I have out here, we worked with very little and look at their success. They've done an amazing job with little resources. So goes to show with a lot of heart what you can do.
And I'm glad you brought up about the sales tax initiatives, because that is a game changer for many cities. The city of Corona has Measure X, and our entire homeless budget is funded out of that 1 cent sales tax. And this year, going to our city council is a $5.6 million request for homeless programs. And Norco is, having discussions about that. So for cities on the line, when looking at different ways to be able to address local needs, it's not always just homelessness. The sales tax initiatives help meet a lot of different needs in the local community. So it's definitely, I think, if you look at cities that are really moving the needle, it's been a game changer for homelessness. I believe Riverside also has one too. So anyways, are there any other questions or comments? You have a seasoned vet here who really knows how to do it. So you you can ask her the hard questions because she'll have the good answers for you.
There was one more question on the chat, Karen. It says, where can we learn more about the cities currently partnered with CityNet?
So we can get that. So David, what I can do is we can follow up and we'll get that from their executive team. At one time, I remember Matt and Jessica texted me, but I think that it's changed. So we'll follow through in an email with them so that we can get that, because I think that would be important for the continuum to know for sure. So yeah, let's follow up afterwards and then we can report back to maybe when you send out the next notice and we get that information, we get that, push that out to the continuum of care. Does that sound like a good idea to you, David?
Yes, ma'am.
Okay. All right. Well, Robin and team, you guys pulled this together in a very short amount of time. I just want to thank you for being flexible. I always say blessed are the flexible. So thank you guys so much for stepping up to the plate. And I do intend to come out and visit you guys.
Please do. We'd love to have you.
Thank you so much. All right. We're going to go ahead and move on to the next agenda item, which is agenda item 5.1, which is the Workforce Development Tax Credit Program. And we have Vicente.
Hello, everybody. Good
Welcome,
afternoon.
Vicente. Good
Yes,
to see you.
good to see you. I'm excited to be here. I am Vicente Nacario from Housing and Workforce Solutions here in the County of Riverside. And I'm a development manager for the Workforce Development Department. And what I'm here to present actually is a little correction. It's not the Work Opportunities Tax Credit, which is another tax credit that's available actually for businesses that basically hire people from public programs. But what I'm here to talk about is the homeless hiring tax credit, which is part of an Assembly Bill 150 that was passed about a year ago. And to start off, what the homeless hiring tax credit is an opportunity for employers basically to attain tax credit up to $10,000 per person. And it's based on a scale up to 3 individuals that are hired for $30,000, basically a maximum of $30,000. And it'll be basically based on a collaboration of different community agencies that will help basically decipher this. So if we can go to the next slide. So the homeless hiring tax credit was available through taxable years that begin in January 2022, so it was last year, through 2027. Basically, what this did was it allocated $30 million in tax credits reservation for businesses who hire individuals experiencing homelessness. Now, the definition of homelessness is pretty broad under this rule. Is basically individuals who experience about 180 days, within 180 days before getting hired. And then that basically is, depending on the events, it's not a continuum of 180 days, but basically throughout 180 days has experienced homelessness. So it's a great opportunity for CBOs and continuing care to refer individuals who are basically job ready to an employer, and they say, hey, if you hire my individual, essentially he's job ready, he's qualified for your position, so that the employers will get an opportunity to get a tax credit for that. And again, to repeat, the employers may claim up to $30,000 per credit per taxable year. And to be eligible, the employee must have a certificate issued by a certifying organization. And I'll go a little bit over that in a little bit. And also, and the process also entails, it's not a hard process actually. They must take a credit reservation with the franchise tax board to claim the credit. And again, I mentioned the maximum is about $10,000 for the individual to be employed. If the person is part-time all the way to potentially a full-time employment, the tax credit varies. So if the if the employee is employed for 500 hours plus to 999 hours for that year, the credit is 2,500. So forth and so on. If they are full-time, they can go a maximum of $10,000. And we can go to the next slide. Again, for the employers to be eligible, how are you eligible for HHTC? For the employers to be eligible, you must take a tentative credit reservation, and that's a process through the franchise tax board that you do once you have employed the individual. Within 30 days of kind of reporting through the EDD, you're able to basically apply for that credit for the following year, essentially. And when they claim a credit for next year, then it's already basically allotted. So essentially what happens is franchise tax board needs these credit reservations because they're putting aside so much money. Again, 30 million is a lot of money, but it can go fast real quick either. And for them to be able to understand what's needed, they need to find out basically how long is the person going to be employed for, how many hours for that year. So they project out that total amount. The franchise tax board projects out that final amount so that you have to reserve that credit so that when it comes time to filing taxes, that you can get that credit for those individuals. Now, what qualifies the employers also is they must employ these individuals to wage that is greater than 120% of the state minimum wage. Currently, the state minimum wage for 2023 is $15, and I believe it's the same at Riverside County. So that amounts to about $18 an hour. So if the person being hired is $18 and above, they will qualify for this credit, or the employer will qualify for this credit. And again, as I mentioned, the employer must make a credit reservation within 30 days of the date of hire or within 60 days of receiving a new certification for a previously certified employee. Oh, sorry, can we go back one? Sorry. So for the employee, they must be certified by a certifying organization. So who are the certifying organization? Obviously, these are the CBOs that are assisting these individuals who are in their programs. A lot of them may be connected with the workforce development, the AJCCs. You might have referred them for training. They're experiencing some homelessness. And what they need is basically a certificate, which could be an attestation or could be, as long as you find them in the HIMS, there would be a certified individual. We can go to the next slide. So when this program started, what the California Workforce Association, which is kind of a nonprofit agency that kind of pulls together the workforce development boards, such as us here in Riverside County throughout the state, to kind of coordinate this. And what we have in the workforce development department here is our business services individuals that can help basically connect you with the businesses that are looking to hire individuals. So if you have a qualified candidate or if we have a job opening, we can also connect and advertise this to our employers to say, hey, this opportunity, if you hire individuals that are experiencing some homelessness, you can get a tax credit. So to be qualified, they have to obtain a certification for an eligible employee, as I said. They have to do a tentative credit reservation. There's a process for that. It's really easy, actually. They'll have to be newly hired employees, and it also can qualify for credit for previously hired and certified employees. And what they ask for the employer is basically the employer name, social security number, the date of hire, hours the employee expected to work for the next 12 months if they are full time. They do maximize that. The starting hourly wage, again, it has to be about 120% above minimum wage, and that HHTC certificate. We go to the next slide, please. And again, a lot of the information is already available, and basically for the employer to look and review at the FDB website. So this is basically the website for that. And here they go through an overview. What do you need? What certification do you need? And it provides all the information for the employer. Again, the key thing here is what I'd like to point out is, because I keep hearing it over, they must not miss that 30-day window, because they might not get that credit for that individual if they hire them. So it's probably a collaboration or coordination between the agencies, could be the Workforce Development Department, and the agency itself, kind of helping the individuals, so that we can get the full credit for the hires that they do hire. And we can go to the last slide here. And as I mentioned, Workforce Development Department is part of this network of AJCCs throughout the county. For our county, we spread out here in Riverside, Indio, Hemet, and also out in Moreno Valley. We have locations there. And our business services team go out throughout the county, and we continue to connect with our employers and provide all these opportunities, including the WIOA program, and programs such as this HHCC. Again, this HHCC is a great opportunity. It's $30 million a year is going to be reserved, I think, all the way to 2016. So if you have individuals that you think are job ready, and you want to basically promote them to any employer, says, hey, you can hire this person, you can obtain this much tax credit. Please do advertise this program as well. And we develop a flyer here. I can provide that for everybody, but this is what we share with our employers and to as far as information. And again, I mentioned the CWA, which is the California Workforce Association, actually did a great, more detailed kind of process on how this goes, which includes how the Franchise Tax Board certifies the employers. If you visit that website in the bottom there, calworkforce.org at HHTC, they have information that they have a PowerPoint presentation as well. So there's another presentation that you'd like to spend time in, but it's very informative. So with that, it's a very short presentation. I appreciate the time. Again, I wanted just to make the correction that this is the hiring homeless tax credit, which is available to our employers and to our CBO partners to look into, basically to promote employment for our clients.
Thank you, Vicente. Do we have questions? This is a great opportunity for our clients throughout the region. So do we have any? If you have questions, please raise your hand, or you can type your question in the chat. And I see David also pasted something in the chat as well.
I will send this flyer to David, and you can have the presentation as well if you like. If you have any questions for me.
Hearing no questions, Vicente, I just want to say great job. Thank you for joining us today. And the WIA folks over there in HWS are fortunate to have you. It's nice to see another Orange County person that's working here, especially since we have Jason on the line today too with us. And so welcome to HWS and the Riverside County Continuum of Care, and for your contributions today. We really appreciate it.
Thank you. Again, have any questions, just you can email us and any more direction on this, so I'll help provide that.
Okay, thank you.
Thank
We're
you
going to
very
go
much.
ahead and move on to the next agenda item. We're going to move to agenda item 6.1, which is the coordinated entry system lead update from our wonderful Morel. Are you here, Morel?
I am. Good afternoon, everyone. My name is Ronald Cabazon, and I am the CES coordinator here with Behavioral Health Home Connect program. I am going to go ahead and steal the screen for a brief moment so I can go ahead and present the CES lead update.
Is it just me or did Morel freeze?
No, she did freeze.
Okay.
You froze.
Let me text her.
It did kick her out, but she's jumping right back in.
Okay.
Madam Chair, would you like us to move out of order or give Morel a second?
That's fine. That's a good idea. We can go out of order. I think Tanya is on. Tanya, are you here? I thought I saw Tanya on. Oh,
I can
there
go
she
ahead
is.
and jump in if.
Okay. Okay, she looks like she's still trying to navigate some AV issues. So sure, if you want to give the Board of Governance update, Emma, go for it.
Sure. Thank you so much. Good afternoon, everyone, and thank you for being here. Emma Perez Singh, Admin Services Manager for the Continuum of Care. So the Board of Governance last met on Tuesday, April 28th. We had one order, new business, which our Madam Chair touched on, which is the teleconferencing changes. So legislative bodies are no longer able to utilize AB 361 for remote meetings. So our next regularly scheduled BOG meeting under the 2023 calendar, which is April 20th, will be held in person. So location is tentatively set for the city of Banning. However, we are still awaiting confirmation. So once we have the meeting location confirmed, we will be sending out an appointment and notification to everyone involved. We had a couple of items approved for, recommended motions approved by the Board of Governance, which included the reprogramming of 2022 ESG funding to support rapid rehousing activities. Approval of funding recommendation for rental assistance and rapid rehousing activities and youth set aside, which I'll be going over in a little bit more detail during the CoC update. And we received approval to reprogram HAP 3 CoC allocation 10% youth set aside from street outreach to operating subsidies. We also received approval for funding recommendation of HAP 3 10% youth set aside of $420,000 in operating subsidies towards the Operation Safe House Mainstay program, which will fund the TAY emergency shelter beds that we currently utilize through Operation Safe House. And that concludes the Board of Governance updates. Thank you.
Thank you, Emma. Any questions for Emma? Okay, seeing none, I think you're gonna, don't know if Morel is back. We'll just go ahead and transition into the next part of your update, which is agenda item 6.3, Continuum of Care and HMIS Lead Agency Update. So Emma, take it away.
Thank you. David, you can go ahead and advance to the next slide. Thank you very much. I wanted to announce that we have a new team member who has joined us here at the CoC, Claudia. and you see her picture there. Claudia has joined our team as we kick off the new PAD Mission Landlord Recruitment Initiative. And this is something that we've been talking about now for several months. She will be heading the PAD Mission setup and building of our landlord database through landlord recruitment. We are very excited to have her. She previously worked in San Diego County and has been involved in working with domestic violence victims and homeless families. So we are very excited to have her on board. We also will be bringing on an additional staff person to support the initiative and also to support our desert area. Next slide, please. All righty, quick update on the encampment resolution funding program. We did submit an application for the San Jacinto River bottom 1 day early, and we requested $15.6 million. Next slide, please. All righty, as promised, here is the rental assistance and rapid rehousing invitation to bid update, which I made reference of during the BOG update. On the 28th, the BOG approved the listed projects for awards. I did want to point out something that I'm very excited about, that we had 3 youth set-aside rapid rehousing awards, RUHS Behavioral Health, Walden, and Equitable Social Solutions. So we're very excited to have additional TAY specific housing available. Next slide, please. In 2023 PIT update, we have completed the deduplication process and have begun the data analysis phase, which is being completed by our HUD consultants. So the plan is to walk the board on results end of April, and we'll facilitate a full presentation during the Board of Supervisors meeting in early May with presentations to the CoC and the BOG to follow. So we just want to make sure that you're aware that we are still analyzing the data and that we will be presenting it to the CoC and BOG in early May. Next slide, please. And the CoC staff report, just want to make sure everyone's aware that we're getting ready to publish another staff report that will be disseminated in April. So please keep an eye out for that. We'll be sending it out through the CoC distribution list, but also have it available at our next meeting. And I believe that concludes my updates. Thank you.
Any questions for Emma? That was a lot. Good job, Emma. Okay. Seeing no raised hand. Oh, Kimberly has a question. Kimberly, let's hear from you. Oh, you're muted, darling.
They give us these fancy headsets. Okay. I was wondering if there's any funding set aside for non-foster youth for rapid rehousing.
Emma, you want to talk about that?
Yes, ma'am. So all of that funding is not specific to foster youth. It's open to any transitional age youth, ages 18 to 24. So it's not specific to system involved youth or formally system involved youth.
That's wonderful. Thank you.
You're welcome.
And if the other partners in the continuum wanted to access those organizations for clients that may need that assistance, what would you recommend for them to how they would contact them? Through Home Connect or?
Yes.
Yeah. Okay. So hopefully everybody knows how to get in touch with Home Connect, which is our coordinated entry system for the not only permanent supportive housing, but also rapid rehousing resources. So if any of you don't know how to connect to that, please let us know. And maybe either Emma or David can put in the chat the way to connect with them in case somebody is not aware of how to, or if Angelica is there, she could mention it. But just want to make sure if there are folks that don't know how to connect to those resources, that you know who to contact, because I'm sure that those funding, I know they're usually will cover a couple of different cities or by a sub-region. Is that right, Emma?
Yes.
Okay. So I don't know if you did I cover that okay, or is there anything else you'd want to mention?
No, David will go ahead and put that in the chat. The only other thing I wanted to mention, because I'm hearing some murmurings internally, is just to remind agencies to make sure that your caseworkers are following up with our CES team. I'm hearing that we're having some delays in connecting individuals to placements because of lack of documentation or information needed. So we want to make sure that, just as a friendly reminder, that all of your outreach workers and case managers, caseworkers are looking out for those emails and communicating back with CES in as expeditiously as possible so that we can facilitate those home connections quickly.
Awesome. I think I saw Monique. Did you have a comment or question? You had your hand up and then it went away. Hey, there you are. Hey,
Hello,
Monique.
hello, folks. So I just wanted to let everybody know that this month we will have our Youth Advisory Committee meeting, and we've been working closely with the City of Riverside with our coordinated entry system. Ra has been phenomenal, and we're coming up with some youth pipeline maps that will be visuals, and we will also be sharing some of these agencies and those contact numbers, and we're going to provide all of our youth providers who need to get their youth connected. We're going to tell you exactly how, what that CES process looks like, how you can access other agencies to get your youth assessed, and then we're going to provide you resources, including those agencies that are currently being funded that can support our youth population. And we're going to talk about some of the efforts in the City of Riverside to end youth homelessness. And so we're going to apply that in the future to the county. So please attend our Youth Advisory Committee meeting to get more information on that. And if you haven't gotten the invite or aren't on our email distribution list, please go ahead and send me an email or send it to coc@rivco.org, and we'll send you the invite for that meeting. Another great opportunity this month is just, and this is probably for announcements, but I have to kind of jump off early to go look at a resource. So just wanting to let everybody know that we will have a webinar, and it's specifically for our UHS behavioral health resources and CoC resources, which will include all of the CES, all of those basic ways to get into homeless services and get your clients what they need. And then we're going to go over our UHS behavioral health resources for mental health services and high barrier clients. And we're going to focus on all of our vulnerable populations at our webinar. So youth, families with children, veterans, elderly. And so please attend our webinar as well. You'll see another email reminder go out, and the flyer should be going out before the end of this week. So please, if you are a case manager, direct service provider, please have all of your staff attend our webinar to continue to get all of these great resources. Anyway, just wanted to share. Thank you, everyone.
Monique,
thank you, Madam Chair.
We're so fortunate to have a warrior like you out there doing everything you possibly can with a larger team to help our youth in this region. We love you. Thank you so much. Morel, did you want to, before we move on, are you here? Because I know you were having technical difficulties. Are you back?
I am. Can you hear me?
Yes. Okay. We're turn it back to you for our coordinated entry system update.
Thank you. For the sake of not being kicked off of Teams again, I am going to try to keep my camera off. It is glitching again, so I might get kicked out, but I am going to try to share my screen. It must be like the 30 Excel sheets I have open. Alrighty, so right off the bat, there was another change to the report, the CES lead update report. In addition to presenting the number of clients housed on the report here, we are also presenting the number of clients that have had other exits. Other exits do entail all other exits where a client is not housed through a housing grant, but rather a program exit where the client's destination is housed with family or friends, whether they self-resolved, whether they have been reported as deceased, and the few other options that Clarity does have available. There has also been an increase in the number of calls for the month of February, as well as the single adult VI-SPID deaths that have been received. At For the month of February, there are also 133 outstanding home connection referrals. Once the home connection referral has been sent out and it has hit that 90-day mark, Home Connect staff has been implementing reaching out to agencies to receive status of that referral. Once the home connection referral has been returned from the housing provider, Home Connect staff will go ahead and upload it in the client's clarity file, just to go ahead and best keep track of the referrals that have been sent and the referrals that have been returned. And this further does ensure that the program exits and entries have been completed by agencies. Currently, there are a total of 671 clients on the queue shown here on the consumer by city breakdown. Before moving on to CES updates, are there any questions I can answer regarding the report shown today?
I don't see Norco. Is it on there?
Norco is not on there. So it's actually one of the update, kind of an update, but we don't have anybody on the queue from Norco. Again, the data is a little skewed because out of all the enrollments that there are, I believe there are maybe a little bit below 3,000 now, because CES has been doing updates. But a lot of the clients are not being referred to the queue, which has been a major barrier in working off of the queue. We do have to go the long way to be able to create and run the reports to ensure that we are referring clients based off of the CES's priority PNPs, policies and procedures. We are working with agencies regarding this. We do hope that it does get better and that the 671 number does improve.
I think back up at the top, before we open it for questions, if you scroll all the way up at the top, I was trying to do an average of what that would be in terms of housed. Is that like about 768? If we took the December, January, February, and averaged that, and then over 12 months, it's about 700 placements per year in the region, if my math was right. Greg, just out of curiosity, in terms of trends, does that sound like to you that we're on an upward trend for housing placements?
Yes, it does, just because we're getting more units online.
Well, I think that's cause for celebration, right? Does anybody have any questions for our wonderful Morel? Chance.
Oh no, that was just a clapping emoji.
Okay, thank you. Thank you for that. We need to celebrate these placements. There's a lot of work that goes into this with many, many different people. So I hope we won't lose sight of that. And all of these numbers that you see on this screen that Merle showed you are all people. And so many people standing behind these clients that need help. So I hope that we can see this as more than just numbers, but amazing work to get people placed in the most important goal, which is housing. So anyways, thank you, Morel. You did a great job as usual.
You are very welcome.
Okay, we are going to go now to agenda item 6.4, which is the housing resource update. We have an update from Greg Rodriguez.
Yeah, not a whole lot to report this time. As far as legislation goes, we're still tracking what the housing bills are. The deadline for first house of introduction passed February 17th, so we're still working with our state partners and advocates around what to back. We'll bring some other stuff to policy and advocacy around the other stuff. As I mentioned, we are increasing our supply of housing. If some of you have noticed in the last few board meetings, there's been direct allocations, either through ARPA dollars or other state programs that we facilitate through the Housing Authority. So we are dramatically, over 2 to 3 years ago, increasing the supply, and most of those units have some type of voucher tied to them or permanent supportive housing units as well. That's really all I've got, unless there's any questions at all.
Well, I have a question. I want to know how we can get one of those cool HWS. Is that a vest or a jacket that's being worn in that photo?
Oh, it's just my jacket.
That's
Oh,
really
you mean the
cool.
one down there?
Yeah,
in the
from
photo?
the photo with supervisor. It looks like a vest or a jacket. That's really neat, you guys, for branding for the department. I love it. That's a totally action shot. Where was that taken, Greg? Do you know, was that Lake Elsinore or?
I'm not.
That's Emma in the picture, so Emma can answer that for you.
It's probably Santa Ana River bottom, I bet, huh?
All right.
That was Lake Elsinore.
Like Elsinore.
Okay,
Mhm.
okay, great. Nice work, everybody. So no questions from Greg, for Greg? Okay, we will move on. You can see there are, it looks like under 7.1, the committee reports, there's only one. You should be able to find the youth committee report in the Google Docs, which is a part of the link that goes out with the meeting. And then also, I always love to give updates on the request for letters of support. Every time David sends me one of these, I jump for joy because it's so exciting to be able to sign as the chair and the vice chair. Michelle and I love to support any type of grant opportunities. And it's really nice when there are requests, usually many different funding sources will look for collaboration with the Continuum of Care. So if you weren't aware of this, we do provide and are happy to provide letters of support. So you can see that we provided one for the City of Riverside for the Permanent Supportive Housing Project, and then also for Labor of Love for the short-term residential therapeutic program. So keep that in mind. If any of you would like us to support you, we always want to do everything we can to bring more resources to our region. And then moving on to the next item, you'll see that there's an annual performance report that's in the Google Docs for you for our coordinated entry system. And then the next agenda item, I believe, is agenda item 8. Are there any requests or calls for agenda items for our next meeting? If you have any ideas, feel free to raise your hand or place your idea in the chat. Or if you think of something in the future, you can let David know at the coc@rivco.org. And then moving on to agenda item number 9 is a time for announcements. Who would like to share any type of an announcement, good news, anything that's happening in your particular organization? Now is your opportunity. Please raise your hands if you have any announcements. Okay, you guys are a quiet bunch today. Okay, then just wanted to point out that you can see before we adjourn under agenda item 10.1. Oh, looks like Angelica, did you want to say something?
I was just gonna share something since no one is sharing anything. It's a little early, but month is a mental health month, and our UHS is gonna have a variety of fairs across our region. So it's a total of 3. So I'll be sending the flyer to David, so David can distribute this across our providers and bring clients, bring providers. If you guys wanna reserve a table so you guys can get to know the community, you guys are welcome. The instructions will be in the flyer that I will send to David. Looking forward to seeing some of you guys out there.
Thank you so much. You are a ray of sunshine in our region, and we sure appreciate everything that you and your team do. Okay, if there are no other announcements, I just want to wish you all a great rest of your day. Thank you for all of the important work that you do in our region, and just know how much myself and the Continuum of Care team at HWS appreciate you beyond measure. Have a great rest of your day, everybody. The meeting is adjourned.
Have a wonderful day, everyone.